So we gave these patients a behavioral task that assessed how they paid attention to pain-related words at the non-conscious perceptual level and the more conscious evaluative level of processing. And we could do this by varying the duration of time that we showed them the words. When we showed them the words for 100 milliseconds, they did not have a lot of time to process the words consciously, but we could observe whether or not they looked towards or away from the words. At 500 milliseconds, they did have time to process the words consciously, and we could observe whether they got stuck thinking and ruminating upon the words. So we found two major differences between the groups that got exposed to mindfulness training and those who did not. Those who were untrained avoided those pain-related words at the non-conscious perceptual level, and those who were trained in mindfulness looked towards the words, suggesting that they had less fear and avoidance and more approach-related behavior towards their pain. And remember, this is a stage of processing that they didn't have any awareness that they were doing this. The untrained group also had a tendency to ruminate or get stuck at the later stages of processing, whereas those trained in mindfulness were able to see the word, let it go, and complete the task more readily. So these results demonstrate that mindfulness training has the ability to improve our mental habits of attention at both the conscious and non-conscious levels.